are now going to be looking at registering patients, and I'm going to hand you over to my colleague Ellie.
Patient registrations are processed by PCSE when submitted by yourself through the GP links. This includes new patient registrations, amendments to existing patient details and deduction requests. PCSE then ensure the PDS is updated and matches what's on your clinical system. One of the things to note is that PCSE don't make any changes to patient records without the information being provided by the practices themselves for the patient. For example, PCSE wouldn't mark a patient as deceased without the information being provided by a patient's GP practice. Typically, though, this is through the links. However, if the patient is marked as formally deceased on the spine or the PDS, it's the same thing, you'll be to receive a deduction sent by the spine, not by PCSE, but via the GP link still.
Thanks, Ellie. So, is there anything that the practice can do to ensure a smooth registration?
So, well, there's a number of ways we can suggest GP practices can help make the registration smoother and avoid the delay. So the first thing is that patient details are correctly entered into the practice clinical system. We need you to make sure that all the information contained has no spelling mistakes or typing errors. These include the birthplace, home address, including the postcode, fully completed, previous home address completed, and any previous names or previous details that you have for the GP would be helpful. Secondly, when searching for a patient, please make sure your smart card is inserted and logged in. Double check that you've checked the correct patient. Ensure they match the exact details provided by the patient, as there may be two or more that have very similar details and it's difficult to distinguish between the two. Thirdly, we recommend that free text and additional note fields aren't always used. It's not mandatory. We don't need them if the text entered in the field can stop registrations going through efficiently if you use it unnecessarily. Also, if you do need to use free text, make sure that it only is being used if it will support us and assist us in tracing the patient. If you're registering a patient under the choice of GP, which is where the practice agreed to maintain the patient on your list but not provide home visits. And finally, for patients joining from a home nation, the registration type selected on your clinical system should be the same as it is if a patient was moving from a practice within England. This allows PCSE to trace the medical records.
Thanks, Ellie. So, thinking about patients transferring from Scotland and Northern Ireland then, could you just run through that with us, please?
So this is quite a common query that we receive. So if a patient was registered with the NHS in Scotland or Northern Ireland and now is registering with a GP practice in England for the first time, they'll need a new NHS number. Then for Northern Irish patients, the National Back Office will aim to try and chase the Northern Irish NHS number. If they do find that, we'll receive an NHS number amendment down the links. That's only for Northern Irish patients. For patients registering in England for the first time, having previously been registered in Scotland or Northern Ireland, please select the type registration on your clinical system that you would if you were registering another patient from England. And include their full previous address, that is their Scottish or Northern Irish address. This will ensure that PCSE have the necessary information to accept the registration, initiating the process to move the medical records using the patient's previous practice. The process is once the registration is accepted by PCSE, the National Back Office will then initiate the deduction for the previous practice, which is in Scotland or Northern Ireland, and then this triggers the medical record to be released. The previous GP practice releases the record to the relevant health board, who then sends the patient record to PCSE via a courier. PCSE then locates the new practice details and sends the patient record to the new practice via City Sprint, or with their usual record delivery. Just one thing to add, that GP to GP notes will not work for patients transferring from GP practices in Northern Ireland and Scotland, so you won't be able to use that function. And a little side note, just as you can imagine, PCSE are reliant and dependent on timely release of the records from the practice, so you need to wait the system. So just to recap really, so Scotland and Irish patients, as you would an English patient, register with the same registration type. PCSE will then allocate a new NHS number, initiate the process, will send you the medical records, and it may take longer than a typical transfer.
That's great. Thanks, Ellie. So with that in mind, I'm going to run through a couple of scenarios. So I'll try and paint a picture of what it'll be like for you guys at the practice. Appreciate you probably do this on a daily basis anyway. If you learn something new, great. If you don't, then that's also great because that means that you're doing everything correctly. So let's have a look at some scenarios then. Okay, so we have Habib, and Habib is an asylum seeker who's now living in England and he needs to see a GP. Now, when Habib has come to register, he has only got one name, which is Habib. He doesn't have a middle name or a surname. He's got no identification, he's got no proof of address, and he doesn't have any NHS number. So, what does Brenda need to do in this situation then? So Brenda will need to ask questions to determine if Habib will be residing in her practice boundary on a permanent basis. If residing outside, then consider whether he may be appropriate for the practice of choice scheme, if this is something that the practice offer. Brenda will then need to ensure that the patient registration form is completed in full and ensure that Habib have completed all the fields correctly. It is good practice to check all the details provided on the form before that is actually submitted to PCSE, basically just to try and reduce the risk of any registrations being rejected. Now, Habib didn't have any ID or proof of address, but this is absolutely fine because ID or proof of address is not required when registering a patient. However, Habib does only have the one name and he doesn't have a surname. Now, ideally, Brenda can discuss with Habib what he would like to add on the online form as his surname, as the NHS system does require patients to have both a forename and a surname. She could ask him if a duplication of his name in both fields is okay. So, for example, it could put Habib, as long as he was happy with that. If not, she will need to come to some agreement with him on what can be used because it is a requirement that there is a surname in that field. Some people put XX, something like that. It just needs to be that there is something that is in that field, or else it will cause a rejected registration. So Brenda now needs to start the registration process on the clinical system. She'll need to select first registration with the NHS, and she'll need to ensure that she completes the UK entry date and ideally provide the date of birth. However, that's not a mandatory field. She'll then need to trace the spine for an existing NHS number. Now, if one can't be traced, it's still okay to submit unnumbered, as PCSE will undertake a trace as well. They'll then need to complete all the other fields with the information provided by Habib and then submit the registration via GP links. Now, if the patient has completed the supplementary questions, then she can scan that form and send that to the NHS England cost recovery team. So what happens next? So once PCSE receive the registration, we will undertake for a trace of the patient with the details provided. If an NHS number can be found, and we are confident that it relates to the patient registering at the practice, the registration will be submitted. If no NHS number can be found, an NHS number will be allocated. Now, under both processes, an approval will be sent with the NHS number, which will update the clinical system. This is an electronic message sent to the GP links confirming the registration. Habib will also receive a letter confirming his NHS number. So just a couple of things that Brenda is going to need to consider then when she is registering Habib. Now, Habib only has one name, so an agreed surname is required. So she'll need to ask whether it is Habib's first registration or it's consider if he's been registered elsewhere. And just to remember that asylum seekers are considered as a standard patient registration. Okay, so now we have Soraya. Soraya is an international student that lives in London and she needs to see a GP. Now, Soraya has already confirmed to Brenda that she was previously registered with a GP practice in England. So what does Brenda need to do? So Soraya will need to follow the same steps as Habib, which is to complete the online patient registration form. Once received, Brenda will need to check all the details that they look correct before entering it on the clinical system where necessary. Now, as Soraya lives in London, it would be a good idea for Brenda to check Soraya's residential address on PAF, which is short for postcode address file. She'll then need to add the registration to the clinical system. However, as Soraya is a student, Brenda will need to register using the code Y0. And as she's already been registered with a GP in England, she'll need to select the registration type that says previously registered with NHS. However, that wording may differ slightly depending on which clinical systems you're using at the practice. So just a few things to summarise then. So Brenda will follow a standard registration process for Soraya, but she'll need to use a student code when adding to the clinical system. We also advise her to check her address on PATH as she lives in London, and some of the London addresses may be displayed differently for London boroughs, which in turn can result in a rejected registration. Okay, so we've now got Mrs. Kumar. Mrs. Kumar is Soraya's grandmother, and she is visiting from Qatar. Now, unfortunately, she's become unwell during her stay, and she needs to see a GP. Now, Mrs. Kumar is only visiting England for 2 months, but like I say, she's become unwell and she needs to see a doctor temporarily. So, what does Brenda need to do in this situation? So, as Mrs. Kumar is not an English resident and is only visiting her granddaughter for a period of 2 months, Brenda can register her as a temporary resident at the practice. Now, this is because she'll only be resident for between 24 hours and 3 months. Now, if Mrs. Kumar were residing in the area for less than 24 hours, then she would be treated as immediate and necessary. Now, for this type of registration, a GMS3 form isn't used. This is because Mrs. Kumar isn't registered with an English GP, and PCSE do not process temporary registrations such as Mrs. Kumar's. We would only deal with the GMS3 side of things once that form has been submitted. Okay, now we have Linda that has recently moved over from Scotland over to England. She has never lived in England before and has never been registered with an English GP practice. So as with Habib's and Soraya's registration, Brenda will need to ask Linda to register using the online form. As Linda's only GP practice registration has been in Scotland, it is important that Brenda uses the correct registration type when she's adding Linda's details to the clinical system. Brenda will need to use the code that states previously registered with the NHS, but again, that might differ depending on which clinical system you're using at the practice. Brenda will also need to make sure that the previous address added to the clinical system is Linda's Scottish address and not the English address. We do find that sometimes there is a little bit of confusion when people are transferring over from a home nation. Just make sure that the previous address is the actual previous address from the home nation rather than the one that's in England. Okay, last but not least, we've got Kevin. So unfortunately, Kevin is homeless. However, he's become unwell and he needs to see a GP. So as Kevin's homeless, that means he has no fixed residential address. So what does Brenda need to do in this situation? So again, same as all the other registrations, Brenda needs Kevin to register using the online form. Now, if Kevin has no online access with being homeless, then the PRF1 form can be used if needed. However, this form isn't available from PCSE and you will need to download that from the NHS website. Now, as Kevin is homeless, he doesn't have a fixed residential address. However, the registration system requires an address to be in that field. So Brenda is going to need to have a discussion with Kevin to see what address they can use. So whether they want to use like a care of address or they agree on a homeless shelter, something like that. As long as there is an agreement made with Kevin, there needs to be an address in that field. Otherwise, it can prompt a rejected registration. Okay, so unfortunately, Brenda has made an error when she was registering Kevin on the clinical system and she's accidentally marked him as female instead of male. These things happen. But what can Brenda do to rectify the error? So it may be that PCSE identify the error and then they just go in and correct the gender. However, the practice can amend this if it is an administrative error and there's no indication of a transition. For this type of admin error, you don't need to contact PCSE to rectify. Okay, so just to summarise then, patient registrations. So no ID is required at the point of registration. A surname must be included on the registration form to PCSE. No proof of address is needed. An address must be included on the registration form sent to PCSE, and we advise that you check addresses on the postcode address file, also known as PAF. From home nations, remember that the last known address must be either the Scottish or Northern Ireland or Welsh address, wherever they're moving from. Someone visiting from outside the UK can be registered as a temporary resident without using the GMS3 form, and use the correct registration type in clinical systems. So, for example, first registration in the UK. But yeah, so that's everything with regards to patient registrations and registering the patient.